Hi, I'm Ken Lawler, and I'm running to be your State House Representative from House District 49 in Alpharetta in the Democratic primary on June 9th. I'm here today to share some thoughts with you about the COVID-19 situation. Where are we now? Where are we going? We've all been affected by this situation, businesses and schools and workers, and there's government relief programs now flowing, which is a good thing. We've all been sheltering in place to stamp out this first wave of infection, and now the governor is loosening the restrictions on our state. So it's logical to ask, well, what happens next? The most important thing I can share with you is this is not the end of the pandemic. The coronavirus is not going away anytime soon. In fact, the vast majority of us have not even been exposed to the virus. In those states that have been testing their populations for exposure, they are discovering that far less than 10% of the folks have been exposed. What does that mean? It means that 90% of us are still vulnerable to the infection. And another wave of infection will be coming. We don't know when, we don't know how bad it will be, but we have a historical precedent. In the 1918-19 Spanish flu epidemic, there were 3 major waves over 2 years. So we can bet on the fact that more waves of infection will be coming in Georgia. But how do we adapt? We can't stay closed forever. We have to strike a balance between public health and getting back to work. So what do we as Georgians, as individuals, need to do, and what does the state need to do? First and foremost, we must continue to focus on public health. That means for all of us, practice social distancing and good hygiene. But especially we have vulnerable people in our population, the elderly, people with compromised immune systems, people with underlying medical conditions. Those folks, you folks, when the virus hits you, it hits you hard. So you have to be especially careful with your social distancing and hygiene. You know, health data should really be driving the reopening policy of Georgia. And we need comprehensive testing to do that. The problem is we don't have enough testing. There's 2 types of testing that we need. The number 1 type of testing that we've already been doing some of is virus testing, which means if you feel sick, you get tested for the virus, it tells us if you have the virus. It tells you if you've caught the illness. That kind of testing allows us to catch the next outbreak when it happens, and we've got some of that already, but not enough. The second kind of testing is immunity testing or antibody testing, where we test a large random sample of the population continuously to figure out what % of us have not yet been exposed. We need to scale up that kind of testing in Georgia to know when it's safe to go back to business as usual. What that means is that we're going to have to be prepared to shelter in place again. It is likely that the governor will issue more shelter in place orders, or we as individuals will need to shelter in place on our own accordance. On a broader public health policy level, there's 2 things we need to do. Number 1 is we should reopen enrollment under the Affordable Care Act for health insurance. 11 other states have already done this. They've said if people wanted a second chance at buying insurance under the Affordable Care Act, they're going to give it to them. I think Georgia should do the same. The problem in Georgia is that we don't control our own marketplace. It's run by the federal government. I therefore call on Brian Kemp, our governor, to raise his hand and advocate for Georgia with the federal government to reopen our ACA marketplace so that people can buy that insurance. The second thing we can do is expand Medicaid under the Affordable Care Act. There are still hundreds of thousands of Georgians who could receive coverage if we had the political will to expand that coverage, but that's not the direction we're currently going. I think now is the time for the governor to take on that task. Let's shift gears from public health to thinking about the economy and our livelihoods. Our state is taking a huge economic hit. It's going to be long-lasting from this situation. Businesses, if you're thinking about reopening, you need to continue practicing distancing, social distancing within that business. You need to be thinking about worker hygiene and cleanliness. You need to help protect the vulnerable people in your business, whether they're workers or customers. That's going to be critical. Our state government is going to face some very difficult choices in the months ahead. We are going to take a multi-billion-dollar hit to our tax revenues. That means we're going to have to be very careful about prioritizing where we spend money in the next budget. I think we should be focusing on public health measures, including the testing, and I also think that we should be preserving education. In Alpharetta, we care a lot about our public schools. People move here because of the good public schools. Public schools are an investment in our future. I would ask the governor and the legislature going back into session this summer to try to preserve education funding as much as possible. I know it will be difficult. But I also think we should think longer term beyond this budget. The state could potentially plan for some recovery projects. Interest rates are at a historic low. could we not issue some low-interest bonds and invest in infrastructure that we need and use that as a recovery vehicle for our economy? I think we should think about it. We may need a special legislative session to accomplish these things. There aren't that many days left in the current legislative session, so if we need a special session, I would ask the governor and the leadership to make that happen. We all need to do our part, folks. We all need to be practicing social distancing and hygiene. We all need to do our part to protect the vulnerable population. Let's try to get back to work, but we need to do it in a sensible way. Please be safe. Please take care of your family, and thank you very much for watching.